Have you heard about the social determinants of health? Do you know the connection between the social determinants and the health information management profession, specifically medical coding? Well, if you don't, then this video is for you. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder. Now let's get right into our next FAQ for you.
What are social determinants of health? Social determinants include societal and environmental conditions such as food, housing, transportation, education, violence, social support, health behaviors, and employment. Social determinants of health are the conditions in which people are born, grow, live, work, and age that shape health. Studies have shown that there is a link between the economic status, social factors, and physical environments as key influencers in health outcomes. Addressing social determinants of health is important for improving health and reducing health disparities. Research has shown that health outcomes are driven by many factors, including underlying genetics, health behaviors, social and environmental factors, and healthcare. While there is currently no consensus in research on the magnitude of the relative contributions of each of these factors to health, studies suggest that health behaviors such as smoking, diet, and exercise, and social and economic factors are the primary drivers of health outcomes. And social and economic factors can shape individuals' health behaviors. For example, children born to parents who have not completed high school are more likely to live in an environment that poses barriers to health, such as a lack of safety, exposed garbage, and substandard housing. They are also less likely to have access to sidewalks, parks, or playgrounds, recreation centers, or a library. Further evidence shows that stress negatively affects health across the lifespan, and that environmental factors may have multi-generational impacts. Addressing social determinants of health is not only important for improving overall health, but also for reducing health disparities that are often rooted in social and economic disadvantages. Understanding data related to social determinants of health is critical as hospitals and health systems work to improve the health of their communities. Currently, hospitals and health systems may capture many of these social factors by utilizing ICD-10 codes included in categories Z55 through Z65, which identify persons with potential health hazards related to socioeconomic and psychosocial circumstances. The data related to social determinants is vital. Using coded data allows hospitals and health systems to better track patient needs and identify solutions to improve the health of our communities. Coding data for social determinants of health, however, are not consistently being reported. The ICD-10 codes are not directly tied to reimbursement, so oftentimes they are overlooked. However, we as HIM professionals and coders know that they are still important for tracking. It's also been shown that the decreased use of these codes exists between a number of identifiable social factors, a provider's ability to address them, and documentation with billing and diagnosis codes. One of the issues that's come up is the actual reporting. Based on ICD-10 CM official guidelines for coding and reporting, coding professionals were not able to report these codes unless they were supported by physician documentation. And as a result, most hospitals and health systems are unable to report these codes because societal environmental conditions are routinely documented and addressed by non-physician providers, such as case managers, discharge planners, social workers, and nurses. According to the AHA Coding Clinic, they have published advice that allows the reporting of the Z codes based on information documented by all clinicians involved in the care of the patient. This advice has also been updated and added to the official coding guidelines. Hospitals and health systems should educate necessary individuals, including physicians, non-physician healthcare providers, and coding professionals, of the important need to collect data on the social determinants of health. Utilizing these codes will allow hospitals and health systems to better track patient needs and identify solutions to improve the health of our communities. As coding professionals review a patient's medical record to identify the appropriate ICD-10 CM codes to include, they should be aware of and begin utilizing the ICD-10 codes included in categories Z55 through Z65. Let's take a look at some of those categories. Z55, problems related to education and literacy. Problems or risk factors included in the category Z55 include illiteracy, schooling unavailable, underachievement in a school, educational maladjustment, and discord with teachers and classmates. Problems and risk factors included in category Z56, problems related to employment and unemployment include unemployment, change of job, threat of job loss, stressful work schedule, discord with boss and workmates, sexual harassment on the job, and military deployment status. Problems and risk factors included in Z59, problems related to housing and economic circumstances include homelessness, inadequate housing, discord with neighbors, lodgers, and landlords, problems related to living in residential institutions, lack of adequate food and safe drinking water, extreme poverty, low income, insufficient social insurance and welfare support. Problems or risk factors included in category Z60, which is problems related to social environment. Adjustment to life cycle transitions, living alone, social exclusion and rejection, target of adverse discrimination and persecution. Problems and risk factors included in category Z62, which is problems related to upbringing, include inadequate parental supervision and control, parental overprotection, upbringing away from parents, child and welfare custody, institutional upbringing, hostility towards and scapegoating of the child, inappropriate excessive parental pressure, personal history of abuse in childhood, personal history of neglect in childhood, parent-child conflict, and sibling rivalry. And problems or risk factors included in category Z63, which are other problems related to primary support group, including family circumstances, include absence of a family member, disappearance and death of family member, disruption of family by separation and divorce, dependent relative needing care at home, stressful life events affecting family and household, stress on the family due to return of family member from military deployment, alcoholism, and drug addiction in the family. For more information on the social determinants of health, you can check out this link, which will be posted in the description box below. Question of the day. Does your organization document and report social determinants of health Z codes? If so, let me know in the comments. I would love to hear your experience regarding that. If you have other questions related to health information or medical coding, feel free to send me your questions via email at cwarner@ohioprn.com.
I'm Clarice Warner, the Girl with the Pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. If you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos. And check this out.
Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified, marketable medical coder. Learn more at bit.ly/5stepscoder.
Feel free to subscribe to our channel and click the bell for notifications when we upload new content. I love hearing from you, so let me know you were here by providing a comment. Hit that thumbs up and share the video as well. Let's stay connected and connect others. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and thanks for watching.